Good afternoon, right? I lose track of time cloudy days. Welcome, everybody. Please be seated. Welcome you to the Gold Room for this press conference and what I consider a very special and significant announcement. And so thank you for your attendance, and particularly members of the press. We're honored to have you here at this time. Let me just kind of review a little bit of history. Dr. David Patton has been a friend of mine for many, many years. I actually started working with David Patton when I was a county commissioner back in Utah County, and we worked together on what was called intergovernmental relations, designed to have government work closely with the state legislators and other stakeholders to help develop good policy for the state of Utah. And it worked extremely well. We actually were a good sound of different issues and made, I think, significant and positive recommendations to the legislature. It was in that environment that I understood and learned of Dr. David Patton's great understanding of policy, his work ethic, demeanor, and his ability to bring people together. So it was with great sadness that I was told here just ago, Dr. Patton to me, that he felt like it was time for him and his family to maybe try another opportunity. It was available to him in the private sector. And so accepting his resignation in that contact for me, and it's going to be hard for the state because he leaves some very big shoes to fill. He's helped lead significant efforts in healthcare here in the state of Utah. He's helped us with administrative issues to kind of get the Department of Health function as efficiently and effectively as possible. And that's not been without challenge. And so I appreciate Dr. Patton's leadership, his ability to administer his job effectively and to bring people together. The challenges of healthcare certainly go from flu epidemics and pandemics to here. Are we prepared to the Ebola outbreak and the concerns we have of that infecting our citizenry, and what do we do, and are we prepared to handle those kinds of things? I'm pleased to say we have been and are, thanks to, again, the leadership of Dr. And he's also worked hard in developing better relationships, I think fostering improved relations with our legislators, our local health departments, and really is asked him to do. And so again, he's as important as anything to me. He's a good friend, and he's been a great part of our Herbert administration team, and we're going to miss him. So we wish him well in his new adventure, and we'll hear from him here in just a minute. He can talk a little bit about that. But I'm also pleased to announce that somebody who I think's feet will fit into his shoes as he takes on the role of the director of our Department of Health. He's got big feet, and so I'm appointing today Dr. Joseph Miner, Dr. David Patton, leader of our Department of Health, subject, of course, to approval by the Senate, which I happen. Dr. Miner, again, I've known for a long time because he had Director of Health in Utah County in 1990 when I was elected as Utah County Commissioner. And so I've been able to see up close and personal his leadership, his ability to lead one of the largest departments of health, local departments of health in our state. The complexities of that organization are significant, and I think that gives him a running head start to take over the state's Department of Health. He will hit the ground running, and his 32 years of experience of leading the Utah County Department of Health, I think, will be a benefit to him in taking over this responsibility. I'll just mention one example of the ingenuity and the expertise of Dr. Miner. In about 2004, probably starting in 2003, we put our significant void in the health care in Utah County, particularly when it comes to the low-income individuals in our community. A lot of Hispanic minorities that were actually not having access to health care for a number of reasons. Lack of funds, and lack of affordability, all those things that go into this. And so with his help, we started, which is still functioning today, the Volunteer Care Clinic. And it's been a blessing to people in Utah County and those some primary health care and some direction in their lives on when it comes to health. And again, the leadership of Dr. Miner in helping us, we found a problem, had a niche in problem market, and found something to fill that niche. And so, again, I appreciate Dr. Miner's leadership in Utah County. He's well respected by his peers, and I think will be, again, a great addition to our team here as he takes over the State Department of Health. His education comes from Brigham Young University and also the University of Utah. So he wears red and blue, I think, all the time. And he can explain his allegiances to us, I guess, where they are. But I know he got his MD in Utah, his master's in Utah, and yet I know he has been a Cougar fan too. So he brings a good blend, that we need in this state to bring people together. So I'm a believer that Dr. Joseph Miner is the right man at the right time for the challenges we face here moving forward with healthcare and all of its iterations. Again, Dr. Patton certainly has done a great work in helping us come together as an alternative to Medicaid. Healthy Utah is what we call it, but and its different iterations going forward. and I expect that he will continue to help us with that as we transition to Dr. Miner, who will help us hopefully bring and get the football across the goal line here in the next few weeks. So with that, let me introduce first to speak to us Dr. David Patton. When he's done speaking, we'll hear from Dr. Joseph Miner, and then we'll see if there's any questions anybody has.
Thank you very much. Very and before we came out here, the governor had another meeting. We were waiting for him and just kind of anticipating what might be said and done out here. So the governor comes out and he says, "Okay, I'm going to say a lot of really nice things. I'm going to lie through my teeth." So he fulfilled his obligation there. But I appreciate, and it's been such an honor, Governor Herbert and his administration and try to help along his priorities. And I'm so proud of him for his stand and what he has done for the people of Utah, particularly with the Medicaid, the Utah plan, the Healthy Utah. He has stood up for that in very difficult circumstances that were not politically easy to do. And so I just want to give him my outstanding leadership. And as he said, I am moving on. Just a day of work today. So it's just kind of like out of the frying pan into the fire. I don't think let up in terms of the stress of the job or those kind of things. But I want to tell you how happy I was as the executive director. I told my staff last week, it's probably the best job I've ever had. And I mean that's. So why would you leave a job like that? I've been like that during my career. I can go on, but this was an opportunity that I was really fortunate to receive and very happy to receive. And it'll be for a company that continues on with the work that I've been building on during these last 6 years at the health department. I've known Dr. Miner ever since I came to the health department. An outstanding leader, an outstanding man who has been a real proponent for public health. Public health is not an easy area to understand. It's not an easy area to work in because if it's going well, no one hears about it, right? We're doing our job. Diseases are spreading, no outcome thing. And so you don't get a lot of publicity or notoriety. But Dr. Miner has done a magnificent job in Utah County, being able to lead that department. As the governor mentioned, one of the largest in the state, and an outstanding staff that we've got there from time to time and do great work. So I am very proud to hand the reins over to someone of Dr. Miner's caliber. He'll be an outstanding leader for the particularly for the State Department of Health. So Dr. Miner.
Governor, thank you very, very much, and Dr. Patton, other state officials here, and I noticed several state health department employees here that I'll enjoy working with very much. The governor and I go way back, as he mentioned. He was our county commissioner 14 years in Utah County. I love his style of leadership. He's been an outstanding governor, as we all know, the most popular governor in the nation, and just elected president of the National Governors Association. I'm extremely honored and fortunate to work with such an outstanding leader as we have, Governor Herbert. And I feel like we're good friends from way back, but really admired his leadership here as governor. And look forward to working with his staff. And I have appreciated very much the outstanding work Dr. Patton has done with the state and the very dedicated that we have there. I'm looking forward to working with them with the many programs, many of which I'm familiar with my 32 years with Utah County Health Department. But there are programs that are unique to the, more than a couple, several that are unique to the State Health Department I'm familiar with, but I'll enjoy learning to lead those areas as well. One being Medicaid expansion, making sure the most vulnerable have the opportunity to have health insurance, and yet something that we can financially afford as a state. This government, the state government, is extremely well managed fiscally, and we can't pay for. And I know many states have gone into debt because of too much debt because of this. So it's being done right, and the leadership of the governor, legislative leadership, Dr. Patton has been excellent, and it looks like they have some agreement that hopefully will succeed. I've had tremendous support from family members, and several of them are here. My wife Gwen, and son Ed, daughter Allison, her husband Stephen Van Orden, and their children. My sister Camilla and her husband George Smith. San Francisco just happened to be in town, and so they happened to be here. So we're thrilled to have. I'm thrilled to have. That was perfect timing. And they just barely notified me this afternoon late, just before. So really enjoyed my 2 years in the health department. Prior to that, I was a couple of years with Weber Morgan Health Department. Ralph Clegg has been an excellent deputy director with Utah County. Lloyd Berenson, local health officer. I'm not sure if we see any others here, but great friends and great leaders in local public health. I know the governor is very committed to having very close relationships with local and local health departments, committed to that, and having a true partnership. And I am in favor of maintaining that and look forward to continuing that as well. But again, thank you very, very much, Governor. I know the tagline for the Utah Department of Health is helping people enjoy the best health possible, and that's what we want to continue with the Utah Department of Health, and we will do that. And Utah's always been among the leaders as far as the rating as the healthiest nations in the healthiest state in the nation, and we're going to continue to be there, if not even a little higher on that list, even though we're top 5, I think, now anyway. Thank you.
Thank you. We have 2 very outstanding public servants here that have demonstrated by their work ethic that they're committed to the state of Utah, and to the people of Utah, the citizens that pay their salaries. And so I thank you on behalf of the people of Utah for your service. Dr. Patton, as you go into the private sector, we wish you well. Again, it's going to have a big challenge ahead of you. And this is not an easy job. I've already told him, come in with your eyes wide open. And he said he understands that and certainly has followed this in his own responsibilities at Utah County. And the opportunities, though, there are significant. And so I feel bad about we're losing a good friend and a good leader, Dr. Patton. I feel very good about who's coming in. And Utah is a great state. We do have great quality health care in Utah, rated about the 5th best in America, and yet the lowest cost. So good environment here to build upon and to move forward. And the continued leadership of Dr. Miner and his colleagues in the Department of Health and the local health departments, and really all of us involved, so we continue to have the successes in Utah going forward. So I just want to reiterate, I have not lied through my teeth. That was a joke back. So he's leaving now, so he. But these are 2 very individuals, and we're blessed to have them here in our state, and the service they've given and the service they're going to give going forward. So with that, again, I know we've got friends, colleagues here. We welcome you all. Any questions from the press?
Governor, you already touched on Medicaid expansion. As we all know, it's been a very long and complicated process. Are you concerned about the transition or the timing of this transition at all in regards to where you stand with Medicaid expansion?
Not concerned about it. Will it be detrimental or will it derail what we're doing? I'm not concerned in that regard. There's always a little bit of a hiccup when you pass the baton off to a new individual. The good news is that Dr. Miner is so up to speed on this issue that it should be a very smooth transition. And Dr. Patton is in that transition. So it should be very smooth with, I think, really minimal disruption. I don't think anybody will notice the disruption. Again, Dr. Miner already knows legislators because of his long service and history, and the other local health departments. So really, if you had to pick somebody to follow in, it's pretty hard to find somebody minor in that regard. So I think it's going to be a very smooth transition, and the concepts and the basis are already there. It's just a matter of kind of putting on some of the final touches. But I think this will just transition very smoothly. Any other questions?
Can we ask of Dr. Miner as well?
Oh, yeah.
Doctor, if you could talk about your philosophy and concepts of Medicaid expansion, and was the Governor's Health Utah plan something you were behind before we got to this point?
Yes, absolutely. I'm supportive of what the legislative leadership has worked out with the Governor and Dr. Patton, the concepts of that, and the making sure that it is affordable, and the plan on how we will pay for it without going into debt or raising taxes significantly, if at all, for it on the general public. I think we all have the uninsured individuals anyway. And we pay for it in one of the most expensive ways, through the emergency rooms and inpatient hospitalization, where they can't be refused care. That's the most expensive way to care for them. This is a way to get health care and keep them well enough. They don't need rooms and hospitalization. And have the compensated care when they do need that care. That way, the hospitals and physicians benefit from having Medicaid coverage when they do care for these individuals.
Dr. Miner, what do you see as your role in dealing with legislators on this issue? Maybe legislators who are skeptical about going down this road. What do you see as your role in communicating with them?
Expressing to them the experience I've had in clinical care that I've done in association with our local health department, and my experience from other physicians and hospital administrators who I've worked closely with in Utah County. I think that experience and of the need for who are uninsured, who are getting uncompensated care in emergency rooms and hospitals. Anyway, this way they'll receive health care in a much more preventive or upfront, early diagnosis and treatment rather than a very expensive way to treat them.
Let me just add too that Dr. Miner brings the unique balance of having been an administrator for a number of years over a local large health department, but is a practicing medical doctor too, affiliated in many different ways, care clinic, but with the University of Utah. And so he brings that as along with his administrative skills. So I think that's going to be a nice blend that will help us, not with this issue, a lot of health issues going forward. Healthcare is certainly the water cooler topic of the day. And there's going to be many iterations as we go through this thing until we finally resolve some of the disputes and differences in Washington, D.C. We have to play the cards we're dealt with, which is what we're trying to do in the most effective manner possible. I think Dr. Miner, because of his sides of the equation, brings a unique talent to this unique time.
I might say for 9 years as local health department director for Utah County, we had no community health center in Utah County. And 23 years ago, we opened the Community Health Center. It's a private nonprofit corporation. I was the physician there for the first months until we started hiring our full-time physicians. And that has been a boon. And now they have 4 locations in Utah County and 1 in Vernal, our Community Health Center. So we've worked very closely with them. I've been on their board the entire time. So I know healthcare for uninsured and for people on Medicaid and Medicare really quite well.
Other questions?
Our last question.
The last question. Ralph, we'll let you ask it.
What will you most miss about Utah?
Oh, you and all the staff have been wonderful. I will really miss Utah County and our great commissioners, one of which is right here, who I've worked with through the many years. Oh yes, it's been wonderful 32 years, and I will miss many of these there. But I actually will still be in touch and will collaborate as partners, as we will with all the local health departments, Lloyd.
Well, thank you one and all. Again, I think this is a new beginning for going forward with healthcare in Utah. And again, I think the goal we all have is to make sure that we have the best quality healthcare in America found here in Utah, that's accessible and affordable. The legislature is concerned about what to do with any kind of Medicaid expansion is sustainable. And I think we are on the right pathway here in Utah. So I think we're very proud of our past, and we're looking very forward to our future here today. So thank you very much.